The answer to today's NCLEX question, bronchoscopy. A nurse cares for a patient who is recovering from a bronchoscopy. Which action does the nurse perform? A. Assist with early ambulation. B. Encourage rapid and deep breaths. C. Position the patient in the lateral recumbent position. D. Confirm the return of the patient's gag reflex. What should we be paying attention to? First, a bronchoscopy is a procedure that lets doctors look at your lungs and air passages. Second, the patient is recovering, so this action takes place after the bronchoscopy is complete. Learn more by clicking the bronchoscopy video in the description. The answer is D. Confirm the return of the patient's gag reflex. The patient's gag reflex must return to normal before allowing oral intake. The procedural sedation may have impaired the gag reflex, which places the patient at risk for aspiration. Ambulation should occur after the patient's conscious sedation wears off, not immediately after the procedure. If the patient attempts to ambulate too early, the patient is at risk for falling and injury. Deep breathing is encouraged, but rapid breathing is not and can lead to acid-base imbalance. The nurse should position the patient in a semi-Fowler or Fowler position to improve diaphragmatic excursion and gas exchange. If you have found value in this content, please consider liking this video and subscribe. Leave a comment below about other topics you'd like to see. Thanks for watching. Happy studying!